Well, welcome and thanks for showing up. Tonight we're going to talk about the ever common problem of low back pain. And my primary hope and goal is not to make you all doctors, not to make you all physical therapists, but more or less to educate you as a layperson on your back, to give you some tips and advice on how to manage back pain and potentially even more importantly, how to prevent low back pain. Oh, my aching back. How many of you have heard that before, said that yourselves before? That was going to be the topic or the title of my presentation, but I decided that was a little bit too pessimistic, so I decided to go with the more forceful, conquering low back pain. And hopefully we'll be able to do that by the end of the night. But I wanted to first, again, keep us all on the same page and talk about what we're going to discuss today. And some of our objectives and goals. The first is to present common causes of low back pain. The second is to discuss potential risk factors. And third is learn some basic anatomy of the back. Now again, I'm not trying to make you physicians or physical therapists. It's important to gain some basic anatomy about the back so that you can put the exercises in context and learn a little bit more about why we're doing certain exercises and recommending them. And then we'll discuss preventive measures, treatment, and when to seek professional advice with regard to back pain. Learn some basics of prehab for your back or preventive rehabilitation for your back. Learn some general exercises for your back from basic to intermediate to even some more advanced and really focusing on proper technique. I think that's where a lot of us fall short when it comes to back pain exercises because they are very difficult to a certain extent and really learning proper technique is really key. Then we'll talk a little bit about the differences between training training for a healthy back and trying to get good back health as opposed to training for performance, say in sports. And then finally, we'll dispel some common myths about low back pain rehabilitation. So let's first talk about some numbers, just some statistics on low back pain. We all know it's a very common problem. I'm sure you can list off 5 people that you know that probably have complained about back pain right away. Well, 80% of the population will experience some form of back pain in their life, and the point prevalence is 15 to 20% per year. So that's quite a few people. It's also the second most common reason for visiting a doctor, your primary care doctor specifically, right behind the common cold. So it's a really very common problem. But there is hope, because 90% of those episodes of back pain will resolve within 4 to 6 weeks, statistically speaking. Another 5% will resolve within about 12 weeks, and then another 5% unfortunately becomes more chronic. So there is quite a bit of hope. Unfortunately, and this is where I think Joy and myself, people that work in this field, can really help out. Unfortunately, greater than 50% of those people that have that initial episode of low back pain will have a recurrence of their pain, usually within the first 6 months or year. So that's where I see my focus on really trying to educate people that have back pain to hopefully prevent those recurrences from, one, being very severe, two, not lasting so long or decreasing the duration and decreasing the frequency of those recurrences. It's probably not realistic because back pain is so common in our society to expect that you'll be pain-free for the rest of your life if you've had a back problem in the past. But I think it is a good goal to try to prevent those recurrences or decrease them in general. So I initially mentioned in the objectives that we were going to dispel some myths. Well, let's talk about some of those myths with regard to low back pain rehabilitation. The first is strengthening the trunk muscles is most protective and should be the focus of rehabilitation programs. Well, strength is certainly very important, but there are other important parts of that rehab program, and it's not really just strength. It's endurance of those muscles, and it's a balance between learning how to control those muscles appropriately as opposed to getting just brute force and strength. And that'll become more clear as we show the exercises and talk about that a little bit more. Then sit-ups and crunches are the best way to strengthen the abdomen. You see people in the gym always trying to get those six-pack of abs, doing lots of sit-ups and crunches. Well, There's been a lot of research that shows that those are pretty unhealthy for the back and can really stress the back out more than actually help. And there are certain techniques that you can do that we're going to talk about later today that will hopefully help you shift from that model of doing sit-ups and crunches and doing more back healthy abdominal exercises. And then another myth is a standard exercise program of trunk and core stabilization is good for anyone with low back pain. This is difficult because I'm sure most of you are coming in here hoping that we could just give you the prescription and say this is what you need to do for your back and this is going to get you healthy. Unfortunately, there's so many different causes for back pain and there's so many different biomechanical issues with each person that has back pain, with the way they're anatomically set up, that we can't necessarily just give you a handwritten prescription and say these are the 5 things you're going to do and you're going to be fine. So we can present some generalities and some basics, but then we'll have to tinker with it a little individually depending on your specific needs. And then the last myth, flexibility is the key to a healthy spine. There's a good balance between flexibility and stability or strength, and it's really not just flexibility that's the key. So what causes low back pain? Well, the short answer is we don't really necessarily know. When I say this to my patients, they get quite disheartened, and rightfully so. It's difficult when you have a problem that we don't necessarily know the answer, but let me put it in a little perspective. The state of medicine for back pain is similar to, say, the state of medicine for chest pain was maybe 75 years ago before coronary angiograms and all those fancy high-tech studies in that. 75 years ago or so, chest pain was more or less just called chest pain. And now with all these fancy studies like angiograms and that, we know there's cardiac or coronary ischemia, coronary vasospasm, pleuritic chest pain from the lungs. There's costochondritis or musculoskeletal causes of chest pain. But with back pain, we're really not there yet. So really back pain is still just back pain, unfortunately. We have good tests like MRIs that help us delineate certain areas anatomically in the back, but we still don't have it down to say when an MRI finding is there that that's really the cause of your back pain. Let's talk about that a little bit. With MRI, which started in about the 1980s or so, we can see the discs in the nerves very well. And I'll show another slide shortly that demonstrates that better. However, many people without low back pain will have disc abnormalities. So even by the age of 30, there are some studies out there that show that you can have abnormalities like disc bulges on your MRI and not have any pain whatsoever. So we can't just say everyone needs to get an MRI and then we know what your cause of back pain is and treat it from there. Unfortunately, that's not the way it works, at least not yet. This is a good picture of a lumbar spine of an MRI, and let's see here. That's a bone, that's a disc, that's a bone, that's a disc, that's the vertebral body or bone, that's a disc, that's a bone, and then that's a disc. So that's what your lumbar spine is made up of, bones and discs for the most part. And then this here is your spinal canal. The dark stuff up here is the spinal cord, and then it ends with the nerve roots coming down and before they exit out into the legs. This white stuff is epidural fat and cerebral spinal fluid. But look at these two discs here, this disc and this disc here. They're disc protrusions that are bulging out into the spinal canal near a nerve here, and another one here. But the L4-5 disc is the one that's bulging out here. I've seen people with this exact same MRI that don't have any pain. So it's hard to necessarily say for sure that this is definitely the cause of their pain. If their clinical exam and their history when I talk to them in the office fits with this picture of pain, then it all fits nicely and I can say, yeah, that probably is the cause of your pain, but I have seen patients with this MRI without any pain. So I don't want you to come out of here thinking that everyone needs to get an MRI when you have back pain, because it's not necessarily true. It sometimes clouds the picture and makes things more confusing than anything. So if we can't talk about what specifically causes low back pain, we do know there's some good research out there that talks about the risk factors or what's associated with back pain. And we know that frequent bending and twisting, lifting, pulling, and pushing are all associated with low back troubles. We also know repeated bending forward, so jobs or sporting activities where you're constantly in a bent forward position is not that great for the discs in your back. And then static work posture, so maintaining that spine forward position is not all that great for prolonged periods. And then interestingly, so those people with sedentary jobs that just sit all day at a computer, that's been associated with back pain too. So what I recommend from this standpoint is to change your position as frequently as possible. You might get the ergonomic guy come into your office and set your computer and your chair all upright, and then you think you're golden because you can sit there for 8 hours a day and just type at that computer. Well, you got to change your position and decrease stress on some of those tissues so that you're altering your position so you're not stressing the same tissues all the time. So let's get to the long answer of what causes low back pain. The short answer was we don't know, but there's a longer answer in there. Before we do that, let's talk about two definitions. First is what low back pain is. And that's what the topic is today, specifically low back pain or non-radiating pain in the lumbar spine. I'm not talking about sciatica. Sciatica is pain that radiates down the leg. That's a whole separate, different talk, and there's different treatment approaches to that. So we're not specifically talking about sciatica. We're just talking about back pain, and not pain that's coming from the back and radiating into the legs. So there's been, over the last 10 or 20 years, a lot of anatomic studies and a lot of clinical studies looking at what has innervation in the back, or what back structures have nerves that could potentially sense pain, which leads us to what structures can possibly cause pain in the back. And I listed all those there. We'll take them all separately. So various structures that can cause pain in the back include the bones or the vertebral bodies. And we're not going to talk about that. The bones are fractures, and that comes from major trauma. That's something pretty obvious. The joints, there's the facet joints, which are the joints at the back of the spine. They're paired joints at the back of the spine at each level. And then the sacroiliac joint are the joints where the sacrum, or the base of the spine, attaches to the pelvis or the ilium. So the SI, sacroiliac joint, is where that comes from. Those can potentially be pain generators. I have a picture of a gymnast up there doing a back bend, because that's not exactly how our bodies were designed to move. And that puts a lot of stress on the low back and those joints specifically in that position. Someone who does things like this, like young gymnasts, really have to have great core stability in the front and in the back to be able to handle those repeated postures of constantly compressing those joints with those back bends. Another potential pain generator that has nerves is the disc, so those cushions in between the bones. I put a picture of rowers or a crew team up there because they really present the double whammy to the discs in your back. They repeatedly go into lumbar flexion. Well, first of all, they're in a seated position, which puts them into a little bit of lumbar flexion or bent forward position. Then they're constantly going back and forth like this, constantly doing more flexion. And then they also do a little bit of rotation there. So flexion, bending forward, and rotation is not really great for your discs. And they're really difficult ones to treat because they really want to get back to their sport, and they're constantly abusing their backs. So there's someone else another group of people who really need great core work and stability to protect their backs. What I'm showing again, just like those MRIs, that's a bone, that's a disc space. You can't see the discs on the X-ray, only on the MRI, but there's a bone, a disc space, a bone, a disc space, a bone, a disc space. This is a pretty normal looking spine with good healthy disc spaces in between each bone. On this one, again, I can't tell if you can see it with the light so bright, but these are the bones again, and then the disc spaces are right there. Look at this disc space here, and look at this disc space there, compared to this one and this one. These two lower ones, this one and this one, are much more narrowed, a sign of degenerative disc disease. Degenerative disc disease is another name for arthritis. In the hip or the knee, it'd be called arthritis, wear and tear arthritis. Degenerative osteoarthritis in the back, it would be called degenerative disc disease, but it more or less means the same thing. It's just wearing and tearing on the discs. The discs get a little bit dehydrated, and then the disc space narrows. That can potentially be a cause of back pain, but I've seen many people with X-rays and MRIs that show this that don't necessarily have back pain. A couple other causes for back pain, or possible potential pain generators in the back, are the ligaments and tendons, the muscles, potentially from a strain, and then the nerves. And we're not going to talk about the nerves tonight because, again, the nerves don't cause axial back pain or back pain just in the low back. The nerves, when they cause pain, it radiates down the leg. Whole nother separate talk. All right, let's talk a little bit about anatomy. Again, I'm not trying to make you clinical people here, but I want to just give you a little bit basic understanding of anatomy so that you can understand when Joy shows her exercises, why we pick certain exercises to do. This is a nice x-ray and then a model showing just that the spine is a very stable structure. It has those gray ligaments on the outside with the discs and the bones in between. And then a back view shows those joints. So facet joint on that side, facet joint on that side. Again, they're paired at each level. There's another one. There's another one. The sacroiliac joints are down here, where the sacrum, the triangular bone at the base of the spine, attaches to the ilium, part of the pelvis, on both sides. And you can see it on the x-ray. The SI joints are here and here. Now let's talk about the muscles, and there's 3 layers of back muscles. The superficial layer is the latissimus dorsi. The reason I point that out, now that's a woman doing a lat pull down on the left there, and that latissimus dorsi is the big broad muscle on the right. The reason I point this out to you is a lot of people that go see a physical therapist and work on back pain rehab, you do shoulder work. And why do you do shoulder work? Specifically because this lat dorsi, which is a shoulder mover, has an attachment to the lumbar spine, so it's one of the key muscles that needs to be worked on. Peeling back the layers of the muscles, then after we pull off the latissimus dorsi, we get to the erector spinae, or the chief spine extensors. These are smaller muscles than that lat, but they also have direct attachments to the lumbar spine, and they're the ones that cause the main extensors are the ones that cause the spine to go back. And then the deep back layer is the multifidus, or the multifidi for plural. These are really key muscles, and this is one of the things that we definitely want you to take home with you tonight, is learning that this is one of the important muscles, and it's a very key, deep muscle in the lumbar spine. It's not easy to recruit, and we'll talk about that more with regard to exercise programs. But you can see that it's a deep muscle that attaches very close to the spine, and it works on segmental control, or it controls the segments, the very specific segments of, say, L4-4-5, L3-4, and then L5-S1. S1 is considered the top of the sacrum. Whereas those other muscles, the erector spinae and the latissimus dorsi, are larger torque-producing muscles that create more movements across the spine. So we'll give fair billing to the front part of the spine now, or the abdominal muscles. And everyone knows about the rectus abdominis, which is that the chief abdominal muscles in the front. They're very superficial. That's where you get your six-pack of abs. Then you have your external obliques there. And then deep to that are the internal obliques, or those side muscles. And then there's the transversus abdominis, a deep abdominal muscle that is not another one that's not very easily recruited, and it's something that is really key to protecting the spine in low back pain rehabilitation programs, is another muscle next to that lumbar multifidi that are really key in working on to gain better control of. And Joy's going to point that out to you very specifically when we get to the exercise portion. That's a muscle that creates a corset or a brace across the abdomen and connects to the lumbar spine very deeply. And it's not one that we can see in the gym and do lots of crunches and see how it works. So it's something that a lot of people neglect, but it's really the key. And we'll talk again more about that specifically. So everyone's heard that term, the core. It's such a buzzword these days with how Pilates and yoga are so popular, and core stability and core exercises are so key. So let's talk about what the core actually is. Well, the core are a set of muscles, and it's a set of muscles that create stability across the low back and the lumbar spine. We've got the lumbar spine muscle that we just talked about, the erector spinae and the multifidus. We've got the abdominal muscles that we just discussed as well. And then we've got other muscles, the pelvic floor muscles, which are deep within our pelvis. We've got the gluteal muscles, which are our side hip muscles and our buttock muscles. And then we've got the piriformis and the muscles that rotate the hips deep inside our pelvis as well. So all those are considered core. So when someone talks about core stability, we're really talking about all those muscles. But I have the multifidus and the transversus abdominis bold there because those are really the key inner core muscles that are really needed, or that really need to be focused on initially in a rehab program for back pain. And then we'll talk about the outer core, which are what you can see on bodybuilders and that sort of stuff. You can see all these guys have great rectus abdominis and great obliques. This is not what we're trying to create here. And I wouldn't vouch for them to say that they definitely have the most stable spine. You can get your rectus abdominis nice and strong and buff, but if you still don't have those deeper inner core muscles working well, you still could be potentially in pretty bad shape with regard to your back. So this is not what we're necessarily trying to create. All right, so let's talk about treatment just in the acute phase or early phase of low back pain. One of the first treatments is pretty obvious, but something you got to tell, especially when I work at sports medicine where we have a lot of high-level athletes. Limiting or cutting out entirely that inciting factor, if there is one. I mean, that's kind of a given. Analgesics, Tylenol, anti-inflammatories potentially for a short time. Icing early on, then heat. People always ask me about when to use ice and when to use heat. There's not a lot of good research to say one is necessarily better than another. I usually think about using ice when something's really acutely flared up or inflamed, and then I use heat before you're trying to do an exercise program to loosen up the muscles or make them more distensible so that you can stretch better. Continue with basic activity, so there's no need for bed rest. There's great research actually done by some of the physicians at the University of Washington 10 or 15 years ago that show that bed rest is actually detrimental to back pain patients. So you want to limit your activities and be smart about it, but you don't need to lay in bed. You don't want to lay in bed. You need to continue your basic activities. And then usually in the absence of any unusual symptoms like fevers or unexplained weight loss or anything like that, there's really no need to necessarily seek evaluation from a medical professional at this point within that first 4 to 6 weeks. Because again, the natural history of back pain is that it usually does resolve within 4 to 6 weeks without doing anything whatsoever. Now let's talk about those people that have pain beyond that 4 to 6 week period. If it's progressively worsening, at that point you should seek your physician's evaluation. That's the time where the physician, depending on what your symptoms are and what your history is, will decide on if other imaging studies are necessary. Usually, someone will get a set of x-rays potentially, or potentially even something more advanced like an MRI at that point, depending on what your symptoms are and what they think they need to look for. At this point, in that after that first 4 to 6 weeks has passed, the treatment's generally the same with regard to continuing that relative rest, but not staying at bed rest, doing general activities. But at this point also, working on active rehabilitation can be helpful, and potentially getting into a physical therapy program and working on some of the exercises that Joy will be showing you in a little bit. And one of the goals of that is to really change your biomechanics to offload some of those tissues, as well as to teach you some things that could hopefully help prevent recurrences of the back pain. Those last two things I have up there are uncommon for standard low back pain. They're better designed for when people have nerve root symptoms radiating into the leg like sciatica and that. But sometimes you can do epidural steroid injections, and potentially even surgery might be thought about at this point, depending on the severity of the symptoms and what the actual cause is. Not something to jump to right away by any means, though. And again, the reason is because most back pain resolves without doing major interventions. So let's talk a little bit about prevention and what does the scientific literature have to say about preventing low back pain. Well, the literature really says that exercise has been the only thing that is shown time and time again to have somewhat of a preventative measure for back pain. Education, just educating patients like in back school, using lumbar supports or braces, and even ergonomic evaluations, so setting up your workplace in the right place, haven't really been proven yet to be preventive for low back pain. So exercise really is the key. And before we get to our rehab exercises and that, I just want to give you some 5 basics for low back pain rehabilitation. And that first is, we need to determine what your goals are. Is it basic healthier back? Are you just someone who's had back pain for a while and just want to get a healthier back and do your general activity and go to work without significant pain? Or are you an athlete who wants to get back to a certain sport and wants to have more performance goals? Those are things that we need to know because you need to have your exercise program tailored accordingly. Low back exercises for health maintenance need to focus more on muscular endurance rather than muscular strength. So think about more repetitions of less demanding exercise. So you hear about in the gym doing high weights and low reps. Same thing with back exercises. If back health is your goal, then doing repetitive exercises at not great or strenuous forces is better than building major strength and power, which are what athletes are going to need. And then the exercise program not only is focused on core endurance and strength, but also on retraining the brain. And what I mean by that is developing motor patterns so that your muscles in your core know what to do when presented with a stress on your back. And that's a difficult concept to get, especially for someone like myself who's kind of a motor moron. That's why I participate in endurance sports and do running and swimming and biking. I don't have to think a lot. I wouldn't be out on the basketball court. I wouldn't be out on the baseball field because I'm one of those motor morons who doesn't have really good body awareness and body control. So with low back pain and core exercises, one of the real goals is to teach you how to use those muscles in the right way and get your brain to learn how to use those muscles without you having to think about it. So a lot of these exercises are done repetitively throughout the day so that your muscles know what to do without you having to really think about it eventually. That's the goal. And then number 4 on this top 5 list is, given that there are many causes of low back pain and all patients are different, there's really not one all-inclusive best rehab program. I think I talked a little bit about that before. And then finally, exercise programs that include aerobic conditioning, such as basic things just like walking, have been shown to be most effective. So having aerobic conditioning involved with your basic exercise program is key. So stages of low back pain rehab. So we talked about this briefly. First is identifying, removing, or limiting those exacerbating activities, those activities that are stressful to your back. During that initial phase, those need to be limited. Gaining awareness of spine position and muscular contractions in the trunk. So again, that's that part about retraining the brain and learning how to use those deep abdominal muscles. We all can go to the gym and do lots of sit-ups and contract our abs till they're painful and contract our rectus abdominis specifically. But we can't necessarily learn just intuitively how to contract those deeper abdominal muscles and those deep back muscles. And that's one of the real keys that we want you to focus on tonight. And part of that key is learning how to control a neutral spine and gaining that inner core or inner abdominal, inner back awareness that Joy's going to talk about in a little bit. And then developing muscular endurance and motor control through basic exercises. And that's where we can stop right there if basic health is your goal for your back. But if performance or athletic performance is a goal, then that's where you have to step up the game to work on really enhancing strength and establishing power. And I make that difference there because to establish strength, to enhance strength and establish power with what athletes have to do, they put themselves at a little bit more risk. There aren't really very easy, safe ways to get those abs that I showed with those bodybuilders that they have. There's not really safe and easy ways. So you have to build up to that and then obviously take some risk too. All right, so let me go to Joy now and introduce Joy Beatty. She's our physical therapist at the Sports Medicine Clinic, and we're going to go over to that side there and talk more about some basic exercises in that.
Thank you. So I don't know about you guys, but my back's a little bit stiff from sitting for so long, so I thought we'd start with some movement and just learn neutral spine. So I have everybody scoot to the front of their chair and just kind of shift around a little bit. Find those sit bones, those bones that you're sitting on. And then just do this in the range of motion that feels okay on your back. Don't push it. But you're going to rock back to the back of your sit bones and rock forward so you exaggerate that arch and the roundedness. And then come to sitting right on top of your sit bones. That should be your neutral spine position. You can check yourself to see if it is by finding the base of your sternum where your ribs start to come out and your pubic bone. Those two spots should form a line, one on top of the other. Some people are going to have a tendency to be a little bit more rounded, and then you can see that the sternum is behind the pubic bone. Those people should come a little bit more forward on their sit bones. And then other people are going to be a little bit too upright, and you can see that the sternum falls in front of the pubic bone. For those people, you should rock back a little bit on your sit bones. This is neutral spine posture. So now you too are ready to begin being a bodybuilder. That's a position that bodybuilders are able to lift those really heavy weights. They maintain that neutral spine position. You can see he's in neutral spine. It's the position where the spine is the most strong, the most efficient, and it protects most of the structures in the back in this position. The next thing we're going to do is start to strengthen some of the muscles that Dr. Harrast talked about, the core muscles, your transverse abdominis, and your multifidus. To find transverse abdominis, you can find your belly button, and again, your pubic bone, and then put your hand in that space right between these two. So right now, your hand is on top of your transverse abdominis. This muscle runs in this transverse position from one hip bone all the way across to the other. So while you're sitting here with your hand, I don't want you to think about pulling your belly button in. Pulling your belly button in will make you activate these big superficial abdominal muscles that we don't want for this exercise. You just want to think about the area underneath your hand, gently pulling it away from your hand. You're going to feel a really subtle low-level tension, and if you're doing it correctly, it's going to feel like you might have a belt tensioning in across your low abs. So some of you are going to find that this is really easy, and others of you are going to feel like you have no idea how to even begin to do this. This is the key exercise to advancing all your abdominal exercises into having a healthy back. So this is the first thing I'd like for you to practice and really master. So again, you'll have your hands here between your belly button and your pubic bone, and just feel like you're gently pulling your belly in away from your hand. The goal is to be able to hold it for 10 seconds, 10 times in a row. It's a postural muscle, and endurance is the most important thing. So we want to have that good hold for many repetitions. So now that we've all found our neutral spine and we all know how to activate those deep core muscles, we're going to start to make it a little bit more functional. When you activate that transverse abdominis and pull it in, it gets that muscular brace that Dr. Harrast talked about. It helps to activate the muscles on the side and the multifidus in the back. So as you master that, you'll get that nice muscular brace all the way around your back. One of the big things I see in the clinic that people have that causes low back pain is they have a tendency to move too much from their back, not enough through their hips. So you'll see people bending over to pick things up, and they're bending through their back. As they do it more, they're going to get more and more flexible through this area, and they'll have back pain. You want to think about bending at your hips. So you'd stick your butt out and bend at your hips, keeping that neutral spine and keeping your belly in. You can tell if you're doing it right if you just march in place and find that crease in your leg where your leg meets your torso. Put your thumbs in that spot, and as you bend, your thumbs should disappear into that crease. And then you know that you're bending through your legs and you're not bending through your back. So there is that famous saying that everybody knows where you should lift with your legs and not with your back. I think it's also good if we think about bending through our legs and not through our back. And again, having that stable spine where you're pulling your belly in and up, and you're also in that neutral spine position. So now we're going to do some exercises. So as Dr. Harrast said, the best thing to do before you start an exercise program is to do a warm-up. You can go for a walk, or you could do cat and camel. So we all know how to walk. I'm going to show you how to do cat and camel. So you want to get into this position on all fours, have your hands right underneath your shoulders and your knees right under your hips, and you're going to round up and look at your belly button, and then you're going to arch, stick your butt and your head out. And so round and look at your belly button, and then arch. At first you can go slow, and as your back loosens up, you can start going a little bit faster. Again, don't push the end ranges of motion, just go in the range that your back tolerates. And it would be best to do that for about 3 to 5 minutes until your back feels like it's good and loose. Then you can start doing a stretching program. The first stretch I'm going to show you is a lunge stretch for your hip flexors. So again, you want to find that nice neutral spine position. In standing, you can do the same kind of thing. You can arch and round until you get into a neutral position. Keep that. Pull those low belly muscles in, the transverse abdominis that we just learned, and then you're going to arch, or you're going to lunge. So you're keeping that neutral spine position. My belly's pulled in. I'm stretching this leg. You want to hold a stretch 30 seconds for each leg and do it on both legs twice. So 30 seconds 2 times, each leg. The next stretch is a quad stretch. You can see in the picture on the left that if you have knee pain, you can use a chair. You can use your sofa, you can use bleachers, you can use your car, whatever you have. Put something, your foot up on something and lean away, and you'll be stretching the front of your thigh. Again, if you hold your low belly muscles in, it'll cause more of a stretch. And then if your knee's okay, you can hold on, and your balance is good, you can hold on to your leg. The next stretch is a hamstring stretch. This is a great way to do it against a wall. You can just put your leg up on the wall, gradually scoot your butt closer. It's nice. You can stretch for a while and really relax into the stretch. The other way that you can do it is to get a towel or a t-shirt or a strap. Lots of people have to bend their knee and then gradually go straight. And just go as far as you can. You want to feel a stretch. You don't want to feel any pain. And hamstring stretches are going to be felt back through here. Again, 30 seconds, twice.
And obviously everyone's not as flexible as Joy, and certainly I'm in that category of not being able to get anywhere close to that. But this is really key. That picture and that picture is lying on your back and supporting your spine so that your spine is stable. You don't rock your pelvis. You see a lot of runners at the track and that will stretch like this, and then they really torque their back a lot. So that's why this is really key, and we like it more in a supine or lying down position.
And then the last stretch I was going to show you is also in the lying down position for the same reason Dr. Harris mentioned, is a piriformis stretch. And that, again, you keep your back in a nice stable position. You put one ankle over the other knee and pull towards you, and you're going to feel it in your piriformis, which is on the outside of my right leg, kind of in this area. This is also an easy one to do in sitting, but you want to keep your back nice and tall. You could all do it right now, actually. Cross one leg over the other. Sit up tall. You're going to feel a stretch in the leg that's bent. If you're flexible, you could push down on your knee and get a little bit more of a stretch. Again, 30 seconds twice on each leg. So now I'm going to go over some basic core exercises that are going to help to strengthen this muscular brace. So at first I'm going to show you an exercise to continue to strengthen this transverse abdominis. And then we're going to do some that strengthen these side muscles and these back muscles. So the first one is a bent knee lift. You're going to lie on your back and get neutral spine position on your back. So you can do that by, again, arching and rounding. You don't want to have your back flat into the mat. So you can go back and forth till you come to rest on your tailbone. You should have a nice, gentle arch in your low back. You should be able to get a finger underneath there. Once you get that, then you're going to pull your low abs in, contract your transverse abdominis, and then lift your leg. And do this on both sides, and I would recommend doing 10 in a row so you get that good muscular endurance. You shouldn't be wobbly. These are to stabilize your spine, so you want to be very stable through your pelvis and your low back. Once those are easy, then you can make them harder by straightening your leg out and bending.
Those look really easy, and I know you're sitting there going, oh geez, why am I here looking at this and seeing that done? But it really is part of the key, and it's a lot harder than it looks because what she's focusing on is keeping that muscular brace, working on pulling in that deeper abdominal muscles, getting contraction of those deeper back muscles, which again aren't very intuitive and really take a lot to learn. And when she's thinking about that, then she starts moving her legs and changing the positions so that she's learning how to stabilize here still with those deep muscles, not using those large torque-producing muscles like the rectus abdominis and that, but those deeper muscles, and holding that in tight, and then moving her legs, and then she starts challenging herself more. So Starting there, and then all the next exercises that are going to be going on are going to get more advanced and look more interesting. But really, this is where it starts, and then you can progress once you learn how to really control those deeper muscles.
So the next exercise is going to focus on these quadratus lumborum muscles and then also the obliques. So you're going to be doing a side bridge. Again, you want to find that neutral spine position. You want to activate this deep transverse abdominis before you lift up. It's going to engage that whole muscular brace and help this to be a stabilization exercise. So you pull your belly in and then you lift up. And again, you want to try to hold 10 seconds and do 10 in a row.
And this is really great for the obliques. So as opposed to doing sit-ups and crunches in the gym and then changing your position back and forth like this, where you see all those guys in the gym trying to work on their obliques, this is a lot more back safe and healthy, and actually quite a bit harder if you do it right.
And then to make it harder, you can straighten your legs out, pull your belly in and up, and then go up. And I would do that on both sides. And then the next exercise is to really focus on the rest of that muscular brace, get that multifidus. The multifidus is in this area, going up your back, attaches segmentally on each of those vertebrae. So on your stomach, have your elbows right beneath your shoulders. My belly is pulled in and up, so I've got that transverse abdominis, which activates that muscular brace, and then lift up. And the whole time I'm up, I'm pulling that transverse abdominis in, and it helps to get all those muscles working. And then again, to make this harder, you can lengthen your legs out, belly in and up, and lift. And then you want to do 10 seconds, work up to 10 seconds 10 times in a row. You can see I need to work up to those. So those are the basic exercises. Those would be great for anybody to do, whether you want to prevent low back pain or you just want to have something to do every day. If you could do 10 sets, 10 seconds, each of those, and then as you get better, you can increase the hold time. So you can increase the seconds or you increase the repetitions.
And you can see, so all of those look pretty back protective, which is keeping that neutral spine and stable base of support. And now we're going to go on to more advanced exercises if you want to get to that next level, which a lot of our athletes do in that. But again, remembering that these are not the healthiest all the time because of the positions and the challenges that you have to give your body. And it's a decision that the patient and the athlete has to make if they want to go there. And a lot of people can get there, but they are a little bit more risky. So I just want to focus on that. And some of the things that we do with regard to advanced rehab programs is still, this is after they've really learned that core muscular brace and learned how to stabilize those deeper muscles and done all of the things that Joy's done. Then we start challenging them in different ways, putting them into multiple planes of motion, working on unstable surfaces and balance and still keeping those core muscles strong while you're on an unstable surface trying to balance yourself. And then working on ball work, which Joy's going to show you, and even doing more sport-specific drills in that.
So the first exercise I'm going to show people are a variety of squats. So this is great for any athlete that needs to use their legs, cyclists, runners, even people that are out in the yard doing yard work or you have to move a lot of things for your jobs. So the perfect squat position is with your feet a little bit wider than your hips, your knees are over your toes, and you squat back so that your knees fall behind your toes. So you want to pretend like you're sitting in a chair. And you can make this harder by holding some weights. And again, I'm trying to keep that neutral spine position and activating my transverse abdominis. You can also do this with a stability ball at your back, going up and down the wall. This is also a great exercise for those people that had a difficult time bending at the hips. This exercise makes you bend at the hips over and over, so it helps to strengthen you to do that activity throughout the day. You can make it more challenging by using an uneven surface. So you stand on it in that same posture and then sit back and up. So I have a stunt double just in case I couldn't do these. And this is sport-specific training for surfing. So if any of your surfers get some unstable surfaces. The next one are doing some squats and lunges. So I brought some of the unstable surfaces, but not the asterisk. So what you can do is think about doing these lunges and these squats in an asterisk position. You can actually put one down on the ground if you like, or just imagine the vectors in your head. You can do it for a lunge. So where you lunge straight ahead in this neutral spine position and out to the side. And then you can also do them back and out to the side and back, and then straight out to the side. You can do them all, that whole circle. Stable, pull your transverse abdominis in and keep that neutral spine position.
I like to keep everything personal here, and I'm thinking these are great exercises for me. Again, I'm a runner who uses my front and my back muscles a lot. I don't use my side hip muscles very well. I don't play tennis, I don't play soccer where I kind of go back and forth from side to side. So doing lunges, not just like this, but doing them in multiple planes to the side, and that can really help create that core stability around your pelvis after you've mastered the abdominal and low back work.
And you can also make those more challenging too by getting some weights. So if you're a basketball player or a soccer player and you got to get down in that ready position, you could get some weights and do some lunges side to side. Again, sticking your butt out so your knees behind your toe, keeping your transverse abdominis pulled in and up, and keeping that neutral spine position. You could also do it on an uneven surface. So if you're going to lunge, just go down and up. And this is great for any field sport, hurdlers, people that need that good ankle strength, as well as that good core stability. You can also do some ball exercises. The ball exercises are great because you can do so many of them, and they're a lot of fun. So you can do a sports-specific exercise that's like swimming. So where you're on your stomach, and I'm not resting on the ball, I'm pulling my transverse abdominis in and up off the ball to help stabilize me and lift one arm and one leg. This really strengthens your back muscles, your glutes. It's also good for overhead athletes because you're strengthening your shoulder muscles. A great exercise to strengthen your hamstrings is doing curls with the ball. So you're rolling forward and back. Again, I'm trying to keep neutral spine and using transverse abdominis. You can also do bridging where you lift up and down. These are great for women athletes to help prevent ACL injuries.
And a good point to this is I'm just noticing that, she's using a ball and she talked about hamstring curls. And, certainly you can go to the gym and work out on the weights and the machines, do hamstring curls and that. You don't necessarily need all that high-tech equipment. You can use just a ball like that. But we like the ball better in general because when you're using the ball on an unstable surface, you're always focusing, again, and I'm just being very repetitive here, on keeping these deeper abdominals and those deeper back muscles very stable while you're doing those exercises, as opposed to going to the gym and getting the weights really high. Then you're really focusing on your hamstring muscle and you're not thinking about your body position in that. So that's why this stuff is really nice.
So some other good ones are doing push-ups and tucks. So you could just do push-ups on the ball, make it easier on yourself by being back at your thighs, and then as it gets easier, go out to your ankles. You can do tucks on the ball. This would be really good for cyclists that are over their handlebars all day, strengthen those abs, and then also for skiers that are doing moguls. It's good abdominal exercise.
Gotta hand it to Joy there. She's doing great.
I think that's my last one. And
She won't do that.
then you could do a pike also. My stunt double's here if you'd like to see it.
We just wanted to give you a flavor of how advanced it can get and how tough some of this stuff can be. And you can see Joy amazingly did a great job when she continued to talk, but it was really tough for her to maintain that neutral spine and keep things stable up here. And that's what's really key when you're using that ball, is just keeping all that stuff constant. So let's wrap things up now. Just some basic concepts that I want to make sure we hammer home. First of all is that concept of retraining the brain. And part of that is what I'm just doing with you guys today, and why I keep being very repetitive and talking about those deeper muscles across your core and keep pressing on my abdomen and my back, because we really are trying to retrain our brain so that we don't have to consciously think about these muscles, or that they just kick in and work to protect our back. Gaining that core muscular endurance again is really the key to maintaining a healthy back. And if you're again going for athletic performance, you want to gain the strength and the power that comes later. You can only remember one point from this talk. It's really remember the concepts of inner core awareness, or inner core recruitment, and neutral spine, the first couple of exercises that Joy talked about. And then I want to stress the importance of prehabilitation. It's kind of my own word, but preventive rehabilitation. So repetitive bending, twisting, stooping, exposure to vibration are not very back-friendly and not very back-healthy. If your sport or job entails doing those repetitively, or any hobby or activity that you like to do, then really a good back prehabilitation program could be quite important and helpful to you. And then remembering we all have different needs. A standardized core stabilization program is not really adequate for everyone with low back pain. An individualized program is best, taking into account the symptoms, the physical exam findings, the activity level, and then the goals of the patient, depending on what those are. And that is it. So I hope you guys learned something today about the basics of core stabilization and low back pain rehab. Thank you very much for all coming.